countries are handling the COVID-19 pandemic. When major events are halted, sporting games cancelled, ships are diverted, companies, schools, stores closed down, movements restricted due to lockdown, and most importantly, global economy in severe damage. One major thing has to come to mind: a global pandemic. The new coronavirus outbreak has since been the cause of this catastrophe affecting the human race. The coronavirus labeled 2019 nCoV or COVID-19 that causes severe acute respiratory syndrome has infected and killed thousands of people in 210 countries and territories around the world. The pandemic of COVID-19 has gradually become complex, as this is a virus with serious impact on public health, the economy, and various social and political issues. Today on Public Announcement, we will be looking at how the pandemic is affecting several countries across the globe and how the coronavirus is being handled. Welcome to Public Announcement. In the UK, the coronavirus outbreak began early in 2020. The first cases were identified in late January, and the number of cases increased rapidly in March. The UK subsequently developed a prototype-specific laboratory test for the disease, after which a public health information campaign was launched to advise people how to lessen the risk of spreading the virus. Guidance on infection prevention and control, how to detect and diagnose COVID-19, and daily update, including advice to travelers.
Unfortunately, we are confronted with this pandemic, which at the moment has no cure, has no vaccine, and we obviously worried that we could come down with the virus. I mean, in the UK, I checked a couple of days ago, about 50 healthcare professionals have died from confirmed COVID disease, and obviously this does worry us. I've had a personal friend who died about a week ago, an excellent doctor in his 60s, and unfortunately he passed away. May his soul rest in peace.
In addition, the National Health Service (NHS) set up COVID-19 drive-through screening centres at some hospitals. On the 12th of March, the UK risk level was raised from moderate to high. From 18th March, UK closed down schools, clubs, restaurants, pubs, and indoor sport and leisure facilities, etc. In late March, Prime Minister Boris Johnson tested positive for the virus, but has since had a steady recovery. On the 26th of March, the heir to the British throne, Prince Charles, tested positive for coronavirus, and this sparked some sort of concerns for the health of the Queen. Fortunately, Queen Elizabeth was not affected, and Prince has currently recovered from the virus. Presently, the UK has had a total of over 133,490 confirmed coronavirus cases and over 1,800 deaths.
Personally, I have adopted a personal approach that any person that presents with respiratory symptoms, whether fully fulfilling the criteria for coronavirus in terms of screening or not, I tend to have a very low threshold for subjecting that person, or at least requesting that person to undergo a test for coronavirus. One of the advantages in that is that it increases the numbers and the rate of testing, which is the goal of one of the goals of the preventive program, and also it also gives some form of assurance that at least you have tried to protect, identify the patient early, and in doing that also protect yourself and other staff members.
In the US, the pandemic that gradually started in the country has somehow put the country with the highest confirmed cases and deaths in the world. The outbreak, which started in the country in January 2020, have affected all 50 US states, the District of Columbia, and all inhabited US territories except American Samoa, and all 50 states have received disaster declarations from the federal government. On the 26th of February, a person with no known exposure to the virus through travel or close contact with a known infected individual tested positive by the Centers for Disease Control and Prevention (CDC). Concerns grew as the federal government's early response to the pandemic was slow, especially in regards to testing. But by the start of March, the government began to heighten its response, With the pandemic, scientists have sought for a vaccine for the virus, and different countries and agencies have all come up with various possible vaccines for the treatment. In March 19, President Trump directed the FDA to accelerate the testing and possible use of certain medications to discover if they would help treat patients who already have COVID-19. Among potential drugs are chloroquine and hydroxychloroquine, which have long been used successfully to treat malaria. This, however, has not been an effective possible treatment. The CDC also warned that widespread transmission of the disease may force large numbers of people to seek health care, which may overload healthcare systems and lead to otherwise preventable deaths. The US records over 820,600 confirmed cases, 45,960 plus deaths, and over 83,203 recoveries.
But from a frontline healthcare professional perspective, anxiety levels are heightened, stress levels are heightened, there's a lot of fear, but the fear has been mitigated by the efforts of government and the effort by hospital facilities in supporting their staff.
On the 15th of March 2020, South Africa President Cyril Ramaphosa declared a national state of disaster following the first confirmed COVID-19 case in the country on March 5th. That led to more cases. President Ramaphosa issued a national lockdown starting on the 26th of March 2020 and has since been extended following a rise in its cases. On the 30th of March 2020, the government announced its intentions of enhancing screening and testing program.
Right now, we're in a lockdown in South Africa. The lockdown started on the 26th of March. So we're approaching the first month of the lockdown. Obviously, the implementation of the lockdown has been quite, I'll say, has received quite mixed reviews, but in the main, it has been quite successful. South Africa apparently has the highest number of COVID-19 infections in Africa.
Presently, South Africa has had over 90,600 tests. As cases keep increasing in the country, Stavros Nicolaou, head of business for South Africa's Healthcare Working Group, says that South Africa has the capacity and kits to do 25,000 tests a day. South Africa records over 3,465 confirmed cases, 50 plus deaths, and over 1,060 recoveries.
I would say that the president of this country has done an extremely exceptional job in preparing the country and also in leading the country during this crisis. He has been very presidential, for lack of a better word, in the way he has implemented his measures and also galvanized the country to work together with him. And we've seen that his cabinet, each portfolio of cabinet, whether it's the health-related portfolios or the social services or the defense-related and justice-related portfolios, have all worked almost hand in glove to try and improve the outcomes or the expected outcomes that is envisaged with regards to this lockdown.
Meanwhile, in China, where the coronavirus originated from, since its first case in November 2019, has had a massive decline in the confirmed cases and deaths. China took extreme measures to curb the spread of the virus. China's response to the virus included strict social distancing and more than a month of citywide lockdowns. Experts also say the biggest contributing factor to China's controlling of the virus has been the aggressive use of quarantines. China also built new hospitals in a rush, with workers toiling night and day to get them done. China walled off entire hospital wards to contain the virus. The cities that were affected were on total lockdown and entirely sanitized. They also used technology that aims to trace every single COVID-19 case. Coronavirus testing in China was easily accessible and free. On April 6, China's National Health Commission reported no new deaths in Wuhan, the epicenter of the outbreak in China, for the first time since the outbreak started. Presently, China records over 1,000 new cases.
We have seen standard isolation centers being set up across the country, which is a good step in the right direction. And these isolation centers are well equipped to take care of the patients. Doctors have proper gear, proper equipment also to discharge the duties. But as for other hospitals, we noticed a shutdown of most private centers due to the pandemic, and there's been complaints of shortage of protective equipment for doctors that are working in most of the general hospitals. So far, we have seen some doctors testing positive for COVID-19, and they have been moved into isolation. We've also seen situations where a patient treated was later diagnosed to have COVID-19, leading to quarantine of the doctors that attending to such a patient.
Coronavirus crisis in Nigeria have been on a roller coaster since the index case was confirmed on the 28th of February, when an Italian citizen in Lagos tested positive for the virus. As the cases increased, Nigerians began having concerns on the effect of the outbreak in the country. Before the lockdown was initiated, individual states had started to take steps such as closing markets, schools, and places of worship. Several weeks after the lockdown directive from the federal government, it is said that activities are beginning to go back to normal as most Nigerians are complaining of hunger and poverty due to the lockdown. The Federal Ministry of Health and the Nigeria Center for Disease Control have, however, raised concerns as number of cases are increasing daily through community transmission. Cases are now being reported in different communities than ever, which has become alarming. States in Nigeria where the COVID-19 has been confirmed include Abuja FCT, Lagos, Kano, Osun, Oyo, Edo, Ogun, Katsina, Kwara, Akwa Ibom, Kaduna, Bauchi, Gombe, Delta, Ekiti, Borno, Ondo, Abia, Enugu, Rivers, Niger, Jigawa, Benue, and Anambra. Yet NCDC Director Dr. Chikwe Yekwazu claims all 36 states in Nigeria are likely to record coronavirus cases. Nigeria records over 780 confirmed cases, over 20 deaths, and over 200 recoveries. With the high rate of transmission and no vaccine in sight, what is the faith of humanity?
The real brunt of everything depends on citizens, those that are adhering to the lockdown. Because I have been able to go around for a bit, and I noticed that most people are not even staying at home. And it is very important. It is the number one way for us to flatten the curve if people can stay at home and adhere to the lockdown strictly. That would really help us healthcare professionals and go a long way in fighting the pandemic.
Containment of COVID-19 must be the top priority for all countries. But at the same time, countries should be preparing for sustained community transmission. If you have any of the symptoms of coronavirus, please seek medical care early. That's all we have for you today on Public Announcements. Till next time, stay safe, avoid trouble, obey the law, and enjoy the week ahead.